Alright, my name is Caitlin. This is my head-to-toe assessment for health assessment class for the Appalachian State RN to BSN program. This is my patient, Mary Ann. And this is my mentor for this project, Emily. Okay, alrighty. So, hi there, my name is Caitlin. I'm going to be your registered nurse today. Do you mind telling me what your name is, your age, your gender, and occupation?
Yes, my name is Mary Ann. I'm 27. I'm a female and I'm a nurse.
Okay, well, great. What's brought you in today?
Just a head-to-toe assessment.
Okay, great. Before we get started, Mary Ann, I'm just going to ask a couple of questions before we get started. Can you tell me what today's date is?
It's November 17th.
Okay, and what year?
2024.
Okay, and can you tell me where we are?
The hospital.
Okay, great. And can you tell me what you were doing last night?
I was studying.
Okay, great. So Mary Ann's speech and hearing is clear. No deficits in hearing my questions. Her appearance is well groomed. Her behavior and her affect is pleasant. Her emotions are within reason. Her outfit is suitable for today and the weather outside in Raleigh. And as well as her thought process is logical and coherent. Okay, all right, so Mary Ann, we're just gonna get started. I'm gonna start on the head. I'm just gonna grab some gloves to get started. Okay. All right. Do you have any questions or concerns before we get started?
No.
Okay. Do you wear any contacts or glasses?
No.
All right. Any hearing aids at all?
No.
Okay. Any other assistive devices that you use while walking or
No.
anything? Okay, great. All right. So first I'm just going to go through and look at your head. Okay. Good. Let me know if anything bothers you. No indentations, no spots of alopecia, hair is well kept, well groomed, no signs of infestation there. Okay, alrighty, okay. If you'll go ahead and look at me, okay, I'm just gonna feel of your skin, okay, just looking for warmth, okay, alright, good. Skin is nice and warm. Your knees feel a little bit cold. Is it too cold in here?
I'm okay.
Okay, great. All right, I'm gonna take these off and go ahead and just feel your face. Your skin is nice and warm. No excess moisture is present. No excess dryness. There's no signs of any lesions or any open wounds, anything of that nature other than freckles as normal, no signs of petechia present on the skin. Your color matches ethnicity. Okay, all right, so I'm just going to palpate above your eyebrows. Let me know if there's any pain or pressure while I'm assessing your frontal sinuses. Any pain there?
Mm-mm.
All right, I'm going to go just below your eyes. Any pain while pressing your maxillary sinuses?
No.
Okay, good. All right, I'm just gonna start off looking at your eyes, okay? No periorbital swelling. Looking at your sclera, they are white. There's no redness, no jaundice signs. I'm gonna press my fingers here, and I'm gonna just pull down your lower lid to look at your conjunctiva. Okay, you can look down a little bit, good. All right, good. Just pink, no redness, no signs of extra drainage, no cracking around the eyes or anything. Okay. All right, I'm just gonna test a couple of things real quick using my light. Okay. Any aversion to bright lights in your eyes?
No.
Okay, great. All right. So I'm just gonna have you look straight at me.
Okay.
I'm gonna shine this light in your eyes. We're testing cranial nerve 2 to look at your reactivity. But first, looking at your eyes, your pupils are equal. They are 2 millimeter in diameter, and you are able to keep your eyes focused on me. They're straight, There's no deviation in either eye. Okay, looking straight at me. I'm going to shine your light over here. Good, reactive in the left. Good, reactive in the right. Okay, all right, and if you will, you're going to follow my finger, and we're going to test your cranial nerve 3, going different angles and testing for cardinal signs, okay? Good, 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 good. No nystagmus present. Smooth, equal movements while following my finger. Okay, we're going to test cranial nerve number 6. I'm going to have you follow my finger side to side. Good. Good. All right, testing cranial nerve number 4 and accommodation. Follow my finger. I'm going to be coming in. Good. Eyes equally come in together. Alrighty, and if you will, I'll have you look up and follow my finger. Good. And good. Okay. Marianne is positive and equal and reactive for all signs, and Perla is good. Okay. All right. So I'm just gonna kind of work my way down. Gonna look at your nose. Okay. All right. So if you can, I'm gonna just look. If you'll look up, I'm gonna shine a light. Good. No signs of cracking, drainage, no signs of polyps, no deviation in her septum. If you will, go ahead and press your nose here for me. On one side, breathe in and out. Good. Now press the other side. Good. And there's Peyton on the left. Maybe a little bit of some sinus congestion on the right. Okay, and then I'm going to grab 2 things, have you smell them. We're going to test your cranial nerve 1. I'm going to have you close your eyes and try and tell me what they are.
Okay.
Alrighty. Alright, I'm just going to be wafting them under your nose.
Alcohol.
Yep. Okay.
Coffee.
Good. Alrighty. You can go ahead and open your eyes now. Alright. And then what I'm going to have you do now, I'm going to look at your mouth, okay? So looking at your lips, they're nice and pink. There's no cracking and no signs of any lesions present. Okay, go ahead and open. I'm going to be shining a light. Good. Her mouth. Oral mucosa is nice and pink, no redness, no signs of any lesions present there. The hard palate of her mouth is nice and smooth, equal ridges on the harder palate. Soft palate is also pink. I'm going to go ahead and have you stick your tongue out, and I'm going to have you say ah. Okay. We're going to be testing cranial nerves 9 and 10 and 12 with your mouth, testing some lateral movement and resistance with your tongue. Okay. So sticking your tongue out, we're going to say, this is testing cranial 10. Good. Awesome. Okay. And if you can, cranial nerve 12, if you'll say the words light, tight, and dynamite.
Light, tight, dynamite.
Good job. Okay. All right. I'm going to grab a tongue depressor, and I'm going to apply some resistance here to your tongue. And this is also going to be testing cranial nerve 12, simulating a gag reflex for cranial nerve 9. We would also be doing this, but in this case, Marianne has asked not to do this part. Okay. All right. And if you will, go ahead and press. I'm just going to press a little bit down on your tongue. Say ah again. All right. Let me grab my light. Sorry. Good. Okay. All right. And so I'm going to have you stick your tongue out, apply resistance upward. Good. Downward. Good. All right. Side to side. Good. Good. Okay. And then one more time, open for me, looking at your teeth, nice and clean. No signs of caries present. Slight occlusal grinding on the right lower side. Okay. All right. So I'm just going to be looking at your ears now. But first, I'm gonna have you puff out your cheeks, smile and frown, testing cranial nerve number 7.
Okay.
So go ahead and puff your cheeks. Good. Smile. Good. Frown and squeeze your eyes real tight. Good. All right. Cranial nerve 7 is intact, symmetrical with each movement. Okay. I'm just gonna feel your ears. Okay. Let me know if there's any pain on the pinna. Any pain there? Okay. And the tragus, check in there. Any pain there?
No.
Okay, good. Any pain behind your ears?
No.
Okay, good. All right, I'm gonna step behind you. We're gonna be testing your cranial nerve 8. It's gonna be a whisper test. What I'm gonna have you do is first I'm gonna step on this side. I'm gonna have you close your ear over here, and I'm gonna whisper 3 words, and I'd like you to repeat those words for me.
Okay.
Okay, go ahead and close that ear.
Right, kite, blue.
Yes. Okay, and go ahead and close this ear. Okay. Pig, drink, clock.
Pig, drink, clock.
Yep, good job. Alrighty. Okay, and one more thing before we move, just looking at your eyes, we're going to check your peripheral vision. So what I'm going to have you do is cover over your left eye, and I'm going to cover my right eye. Good.
Okay.
Good job. Okay, so what I'm going to do is I'm going to hold up some numbers on my hand. I'm going to have you try and figure out what those numbers are while looking straight at me.
Okay.
Okay?
2,
Good.
1, 3, 4.
Good. All right, and keeping that eye covered, I'm going to come from this side.
Okay.
Stay looking at me. You're good.
2,
Good.
1,
Uh-huh.
4.
Good. Okay. All right, and same thing with the other side. You can let your eyes adjust while having it covered. Okay, good. All right.
2, 1, 3.
Good.
2, 5, 2.
Good. All right. Peripheral vision is intact and able to see. Okay. All righty. So now that we're going head to toe, I'm just going to check your lymph nodes. Go in there. I'm also going to have you clench your teeth. I'm going to be pressing over here. Go ahead and clench. Good. And stay clenched for me. Good. Now go ahead and open. Good. Slight popping on the left side with opening of the jaw. Cranial nerve 5 is intact with the clenching. All right, so I'm just gonna take this soft bristle brush. I want you to close your eyes, and when you feel it, I'm gonna have you say yes. This is also testing cranial nerve 5.
Yes.
Good.
Yes. 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 Yes.
Good. Alrighty. Alright. So I'm just gonna be pressing and feeling for any swollen lymph nodes, your preauricular here, your postauricular, occipital, okay, parotid there, okay, jugular under the mastoid. Alright, submandibular, submental, good. I'm going to kind of work my way down your neck, going down, and posterior, alright, and supraclavicular, good. Any pain or tenderness while I was pressing in those areas? No. Okay, so I am going to go ahead and just check your trachea real quick, and then I am going to be stepping behind you for a further assessment of your thyroid. Okay, good. Alright, trachea is midline, no deviation there. Okay. And then I know you brought in a drink with you, so I'm going to have you hold this, and when I tell you, I'm going to have you take a swallow.
Okay.
Okay. Alright, so I'm going to be placing my hands around your neck, feeling for your thyroid, feeling for your hyoid, just feeling the movement in your throat. Alright, when you're ready, go ahead and take a swallow. Okay. Good movement there. And one more time. Good. All right. Movement present and equal. Now. All right. There you go. Okay. All right. So I'm just gonna assess your skin turgor here, and then I'm gonna assess on the back of your hand. Good. All right. Good. And while I have your hand, I'm just gonna go ahead and look at your capillary refill. Good. 2 seconds. Nice and normal. I'm going to feel your pulses on your wrist. Okay, your radial pulse. Good. 2+. I'm going to feel your brachial. Okay, 2+ and equal there. Okay, I'm just going to feel of your carotid artery while we're standing here. I'm going to do the left side first. Good, nice, 2+. Nice, and 2+. I'm going to go ahead and listen for any bruise. Okay. And if you can, just hold your breath for 3 seconds. Good. No bruise. Good. No bruise present. Okay. I'm just going to go on your back side. I'm going to be listening on your back, okay? We're going to go through a series of assessments on your back. I'm actually going to come back around and have you stand up while we do this, and then that way. Okay. If you'll turn and face that door for me. Good. And also to comment, nice erect posture while standing in an equal stance. Okay, so I'm just going to go through and listen to you breathe in, just nice deep breaths in and out of your mouth. Okay, go ahead and take a deep breath in and out. Good. 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 Just going in a zigzag motion. Good. 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 All right, 2 more times. Good. All right. Breath sounds are clear. No signs of any bronchi cracks or wheezing present. Skin is nice and clear. No lesions present on the back. Just normal signs of freckles. Okay, so I'm going to be placing my hands on the sides and right below here. I'm going to have you take a deep breath in to check your expansion. Go ahead. Nice, and blow it out. Good. Nice and equal on both sides. Diameter anteriorly and posteriorly of the rib cage is a normal ratio. Width from front anterior to posterior is half the size laterally. Okay, all right. And so from here, I'm going to go through. I'm going to have you say the word 99. I'm going to be pressing my hand in different areas. Okay, and go ahead and say
99.
Good.
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 99.
Good. Okay. And I'm just going to go through and palpate different or percuss in different areas. And same formation as listening. Good. All right. No sounds of dents there. Okay, I'm just gonna check for CVA tenderness in your lower back. I'm just going to be pressing my hand here on your lower back. You're going to feel my hand hit my hand, so it won't be hitting you. So let me know if there's any tenderness there. Okay, 1, 2, 3.
No.
Okay. 1, 2, 3.
No.
Good. All right. Okay, you can go ahead and sit back down for me. All right. I'm just gonna go ahead, listen to you breathe on the front, and then listen to your heart. Okay. Deep breath in and out. Good. 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 I'm just going to place my stethoscope just below, right here on your lower rib cage. Breathe in. Good. All right. Good. Good. All lobes are clear. No adventitious sounds heard. Okay, I'm just gonna listen to your heartbeat, but I'm actually gonna have I'm gonna have you sit up for this as well, and then I'm gonna lay down and look at your stomach. Okay.
Okay.
All right. All right. And just breathe as normal. Good, and I'm just going to go just below here, mid-clavicular, fifth intercostal, listen to the point of maximum impulse. Good, S1, S2 heard, and all 5 sites. All right, with the bell of my stethoscope, I'm just going to listen for any more fine-tuned noises. Good. Go back up. Okay, great. Alrighty. And if you will, I'm going to go ahead and have you lay back for me. Okay, alright. And then I'm just gonna look at your neck, and I'm gonna raise you up just a bit, and then lay you back flat. Okay, and I'm just gonna pillow too much.
Yeah.
There.
Thank you.
Yeah. Okay. All right. Just looking for any jugular vein distension on your left. So just breathe as normal. No signs of distension on the left. Good, no signs of distension on the right. Okay, I'm just gonna lay you back flat. You doing okay?
Mm-hmm.
Okay. Sorry. Oh, there we go. Okay, I'm just gonna go through, listen to your stomach and inspect it. No signs of distension or asymmetry in the abdomen. Okay. Just going from right. Whoa. Good, okay. Sounds heard in all 4 quadrants, active, tad bit of growling going on. Okay, so now I'm just gonna go through. I'm gonna do some palpation and percussion.
Okay.
Let me know if anything bothers you or you feel like any pressure while doing this. And go ahead and okay. And go ahead and press. Lightly press. Any pain while pressing around? Okay. Good. On percussion, no signs of density there. Okay. And Marianne, if I can, I'm gonna have you take your shoes and socks off for this. I'm just going to feel the pulses on your dorsal piece on the top. Your feet are cold.
I know, I have thoracic.
Yeah. Your toes are a little white. Okay, 2+ felt there. Then posterior tibialis. 2+ felt. Good. Good. Okay, I'm just going to squeeze your toe and check your capillary refill. Alright, 4-second capillary refill. Bit slower than your hands. Slight whiteness in your feet, but the coloration is coming back with the socks off. If you want to, you can go ahead and put your socks on, but I'm going to have you keep your shoes off for just a bit longer.
Okay.
Alright, what I'm going to have you do is I'm going to have you pull your feet back towards you. Good. And press them against me. Good. Equal strength in both right and left leg. Alright, if you can, I'm going to have you press against my hand and pushing outward. Good. Inward. Good. Outward. Good. And inward. Good. Equal strength there. Try and raise your left leg up. Good. And down. Good. Okay. We're going to have check your pulses on the back of your knee, your popliteal pulse. Good. Okay, good. Your lower legs are a bit cold. Okay, I'm going to have you continue to lay back, and we're going to bend this knee to your chest. I'm going to feel for any popping or anything or any discomfort here.
Okay.
Okay, if you'll bring this. Good. Any discomfort there?
No.
Okay, good. Alright. Alright. Same thing for this side. Good. Any discomfort there?
No.
Okay, great. Alright. If you can, I'm going to go ahead and have you sit up for me. I'm going to test your strength in your upper body. So what I'm going to have you do is with your hands palm facing up, I'm going to have you press against my hands. Good. And press down. Good. Okay. Hands out in front like this. I'm going to have you press against. Good. And back. Good. All right. Equal strength there. Any tenderness while doing that? Okay. Great. I'm going to have you put your arms out to your side. I'm going to have you raise one up. Good. And down. Raise the other one up. Good. Back down. Take one arm, take your right arm and drop it to your side. Take your left arm, bring it around, touch your back. Good. Bring it back, down by your side. Okay, same thing with the right arm, bringing it up, back. Good. And down. Good. Nice smooth motion. No pain there. Didn't hear any clicks as you were moving. Heard no clicks while you were bending your legs there. Okay. All right, and I'm going to go ahead and check your reflexes in your popliteal and in your Achilles, okay?
Okay.
I'm just going to use the bell of my stethoscope to do this. I want you to stay nice and loose. with your legs. Okay, good. Reflex is good in the right. Equal reflex in the left. All right, same thing for here. I'm just gonna have you keep your foot nice and loose. All right, good. Reflex present. All right, nice and loose. Good, reflex present there. Okay, and then what I'd like to have you do is go ahead and put your shoes on. I'm gonna have you stand up. You're good.
Okay.
Okay. All right. So standing up, I'm going to have you have your feet together, hands by your side,
Okay.
and I'm going to have you close your eyes. This is a Romberg test. So what I'm looking for is just you to stand, have your eyes closed, and just for a few seconds. Good. You can go ahead and open your eyes. Nice and stable, steady while standing. Negative for any balance off there. All right, and if you can, I'm going to have you hands out to your side. I'm going to have you touch your nose with one hand and then the other. Good. Nice coordinated movement, easy and smooth. All right, if you'll go to the door, I'm just going to watch you walk. Nice. Okay, and walk into the wall. Nice, steady, balanced gait. Okay, if you'll go ahead and sit back down for me. So I'm going to have you do a rapid movement where you will tap your leg, hand down, palm, hand, palm,
Okay.
as fast as you can, looking for your cerebellum motor responses.
Okay.
All right, and go ahead. Nice, coordinated. All right, good. Okay, and then last thing I'm gonna have you do, apologize, I'm gonna have you stand up one more time.
Okay.
And I'm gonna have you look to this wall here, and then look to this wall here, look up, good, look down. Any pain while doing that? Okay, I'm gonna have you turn your body and face this wall. Okay, with your feet about shoulder width apart now, I'm going to have you just go down nice and slow, touch your toes. I'm going to be standing behind you, just looking at your back,
Okay.
looking at your spine. Okay, when you're ready. Good, nice fluid movement. Spine is nice and in line. No curvatures present. Okay, great. All right. Okay, do you have any other questions or concerns?
I don't think so.
Okay, and just making sure that we tested everything and everything was noted. When we did the light in your eyes, that was test cranial nerve number 2 for reactivity there. Okay, all right. Any other questions?
No.
Okay, great. All right, thank you so much.
Yeah.
Hi, I'm Regina. I'm going to be your nurse today. Patient privacy, hand hygiene. Can I get a name and date of birth?
Anastasia Bear, 04/16/2004.
All right, and do you have any allergies I need to be aware of?
No.
All right, perfect. So today we're going to be doing a head-to-toe assessment. And so before the provider comes and sees you, I'm just going to be checking all of your general systems, just making sure everything's good to go, noting anything abnormal. All right, do you have any questions for me?
No.
Perfect. Should only take about 10 to 15 minutes. Thank you for your time. And so we're going to start just with some simple questions. So can you tell me what the date is?
That is Thursday, November 14th.
Mm-hmm. And can you tell me where we are?
We're in the skills lab.
Mm-hmm. And can you tell me who the president is?
Joe Biden.
All right, so patient is alert and oriented ×4. Just from here, I can see hearing appears adequate. I don't have to raise my voice. Speech is clear, not slurred. Do you use any hearing assistance?
No.
No. Do you work with glasses or contacts?
I have both.
All right, and are you wearing contacts right now?
Yeah.
Okay, can you read my name badge?
Regina B, BSN, student, School of Nursing.
Perfect. All right, and just your general appearance. You can see hygiene appears good. Patient appears in good spirits. Posture is upright. No obvious deformities noted. No lines, tubes, or drains. Are you in any pain today?
No.
No? All right, perfect. And let me see. So I'm going to have you just grab my arms. Okay, pull me towards you. Push me away. All right, stick out your feet. Push down. Push towards you. All right, so strength is equal and intact in all 4 extremities. You can close your eyes. Where am I touching you?
Left arm. Right arm. Right leg. Left leg.
All right, you can open your eyes. Sensation is intact and equal in all 4 extremities. Can you give me a big smile? All right, and then puff out your cheeks. Okay, perfect. And what would you say is your mood today?
Pretty good.
Pretty good. All right, patient is in good spirits. All right, and then I'm just going to take a look at your head. I'm just going to inspect it first. Okay. Let me see. Hair is clean. No dentitions, no excoriation, no lesions noted, no infestations. I'm just going to feel it real quick. Right, head is normal cephalic, atraumatic. Perfect. And I'm just going to look at your eyes. Let's see. Conjunctiva is pink and moist in bilateral eyes. Sclera is white in bilateral eyes. Okay. Okay. And if you can just follow my pen. Okay. Okay, pupils are equal and round, reactive to light and accommodation. Great. And then I'm just going to check your ears. Alright, no redness or drainage noted in bilateral ears. Patient does have subtle piercings above. Just going to take a look at your nose if you'll tilt back for me. Right, no nasal deviation, no obstructions or occlusions. Can you cover one nostril and breathe without the other? Okay, and then to the other side. All right, bilateral nares are patent. You can open your mouth for me. Right, good dentition, no cavities. Oral mucosa is pink and moist. Tongue is midline. Great, and just I'm gonna look at your overall skin on your face and ears. Also your neck line here and chest. All right, no lesions, no papules, no redness. Color is appropriate to ethnicity. Skin is warm and dry to touch. Great. And let me see. So now I'm just going to listen to some of your heart sounds. So I'm going to palpate your carotid artery. All right, pupil pulses are equal in strength bilaterally to carotid arteries, no bounding pulse. I'm also just going to take a listen. All right, no bruits or thrills. And then can you lean your head back and look to your right? Okay. Look to your left. Right, no jugular vein distension noted. And then I'm going to palpate your pulses on your upper and lower extremities. You can hold out your arms for me. All right, brachial pulses are equal in strength bilaterally. Radial pulses are equal in strength bilaterally. And pedal pulses are equal in strength bilaterally. And I'm also going to check your capillary refill. All right, brisk capillary refill, less than 2 seconds in bilateral upper extremities. Okay, and brisk capillary refills in bilateral lower extremities, less than 2 seconds. Just gonna do some hand hygiene. Okay, and now I'm gonna listen to your heart sounds. Actually, you know what? Let me just double check the skin while I was already looking at it on your upper and lower extremities. Alright, color is appropriate for ethnicity, no redness, no lesions, no papules noted on bilateral upper and lower extremities. Okay, and now I'm going to listen to your heart sounds. Right, regular rate and rhythm in all the 4 heart sound places that I've listened to. No murmurs, no gallops, no rubs noted. S1 and S2 sounds heard. Okay, and now I'm gonna just check your respiratory system. So just from what I've seen during this exam, breathing appears, chest expansion appears symmetrical, no increased work of breathing, appears to be a regular rate. Let's see. Okay, and no cough noted on exam. Okay, and I'm just gonna listen to your breath sounds. Just take some deep breaths for me. Alright, so no crackles, wheezes, rhonchi, rails, or diminished breath sounds heard anteriorly. Now I'm going to check your medial. I'm going to check your breath sounds medially. If you'll raise your right arms for me. Just take some more deep breaths. Alright, no crackles, wheezes, rails, rhonchi, or diminished breath sounds heard medially. And I'm just going to check your posterior breath sounds. Just keep on taking deep breaths. Alright, no crackles, wheezes, rails, or rhonchi, or diminished breath sounds heard posteriorly. Everything sounds really great. And then next we're going to move on to your genitourinary system. So how often would you say that you have bowel movements?
Like once or twice a day.
Once or twice a day. And did you have a bowel movement today?
Yeah.
Okay, and was it like normal color, consistency?
Yeah.
Alright, perfect. And then your urine, how many times do you urinate a day?
Probably like 4 or 5.
Alright, and when was the last time that you urinated?
Like an hour ago.
An hour ago, okay. And was it normal color, odor,
Yeah.
consistency? Alright, perfect. And I'm just going to have you lay back and I'm going to check out your abdomen. Alright, if you can pull your shirt up for me. Alright, perfect. Okay, just going to check out the skin first. Alright, so no redness, no lesions, no pulsations, no obvious hernia noted. Color is appropriate for ethnicity, warm and dry to touch. Okay, it appears flat, non-distended. Okay, and now I'm just going to auscultate your abdominal sounds, your bowel sounds. Okay, active bowel sounds heard in all 4 quadrants. Alright, and then I'm just going to palpate. Tell me if there's any tenderness. Right, did any of that hurt? Okay, abdomen was soft, non-tender, no rebound or guarding. Right, I'm just going to percuss. Equal percussions in all 4 quadrants, no abnormally deep or hollow sounds. Right, if you want to cover yourself back up and sit up for me. Right, and I'm just going to go over your musculoskeletal. If you could take your chin and just touch it to your chest. Right, and then look up at the ceiling. Okay, turn to the right, to the left. Right, full range of motion in the neck, no rigidity. Okay, and if you could just lift your arms up and then lean over and touch your toes. Alright, full range of motion in the back. And then I'm just going to take your arm. right, full passive range of motion without crepitus in the bilateral upper extremities, and I'm just going to check the legs. Right, full passive range of motion without crepitus in the bilateral lower extremities, hand hygiene. I think the last thing we're going to do is I'm going to have you stand up for me. I'm going to have you walk over there. Right, and then walk back. All right, so gait is steady and even, no limping noted. All right, and I believe that concludes our head-to-toe assessment. Do you have any questions for me?
No.
All right, perfect. Thank you so much for your time. I'm going to go let the provider know that you're ready to be seen. Thank you. And hygiene.